When you're giving good care, those patients know that you're doing a good job for them, and they're grateful, and they show it, and they say it all the time. And you go home with that in your pocket. I am Stephanie, and I'm a registered nurse case manager. I've been with Commonheart Home Health for about 4.5 years. Before I was with Commonheart, I worked with a long-term care facility, but I knew that I wanted to do more with the skills that I'd learned. I had a few girlfriends that worked at Commonheart, so I applied. I wanted hospice, but they said, well, we don't have an opening with hospice right now. Would you be willing to do home health for a little while and see how it goes? And when we have an opening, you can just transition over. And I said, okay. But I started and I just really loved home health. So when the opening with hospice came up, I said, no, I would really like to stay with home health. This is my forever job. Commonheart Home Health is an absolute community of nurses that work together, support each other. All the nurses that are in our offices have all been field nurses. They've all been where I am now. So they know what my day feels like. We have a morning meeting every day at 8:05, and it goes maybe 20 minutes. And then I start organizing. I call my first patient. Maybe I see them at 9 or 9:30. We have an on-call rotation that's every 5 weeks, and we're on with other nurses. I feel the best personality traits to give the best care are things like wanting to learn. Commonheart is very good about wanting some of their nurses to become wound care certified. That really advances your knowledge. It looks great on your resume, better patient outcome. We have a limited amount of patients that we see in a day because if you're rushing through patients, you're not giving good patient care, and you're gonna have caregiver burnout. I feel that I work for a company that really values their patients as well as their workers. I think the biggest thing about home health is that I see the validity of my work every day. I build really beautiful relationships with my patients. This is a lovely way to earn a living, to pay for my family, and to feel that I'm really doing something for my community, those individual patients and their families. This is absolutely my calling.